how do we measure kidney function, okay? And you all have, some of you have sort of asked about this secondhand, so we're going to just cover it easily and blankly. First is inulin. Inulin is a molecule that is freely filtered but not absorbed or secreted. Now, this isn't a naturally occurring molecule, all right? We give patients inulin, okay? So the way this test works is we measure a particular amount of inulin. We give the patient that inulin over a particular amount of time. Okay, then we measure how much inulin appears in their urine, and we can do a little math, right? We can take the amount of urine that, or amount of inulin that appeared in the urine over the time it took to appear there, and we can identify glomerular filtration, right? So this is the best way to test glomerular filtration rate. The downside is you got to put an IV in, you got to have the patient collect their urine for 24 hours, and then you got to do the math, right? So we will do this if we need to, but usually we just use creatinine as kind of a fill-in for this. Creatinine is a natural product. It's made by muscle metabolism. Like inulin, it is filtered, but not much reabsorbed or secreted, okay? So what it does is it works similar to this, but we don't know how much the patient, we don't know this factor, right? You know, we gave them the inulin. Creatinine is something the patient made, and each person is going to make a little bit different. Like the more muscle mass you have, the more creatinine you make. So the point is, at any given time, we don't know how much creatinine you made today. But we can assume that you made about the same amount today that you've made every day for the last year, right? So if we looked at your creatinine a year ago, and it was 1, and today it's 2, we assume you're making the same amount of creatinine, right? So your GFR must be half of what it was a year ago. Okay, that's kind of how we use creatinine. A doubling of creatinine is a halving of GFR, all right? Now, there are a lot of things to know about creatinine, and we'll probably cover many of those later, but one of them is it's related to lean muscle mass, okay? So the less muscle you have, the lower your creatinine, okay? So if you have like a newborn, their creatinine is going to be like 0.1, okay? And that's normal. If you had a newborn with a creatinine of 1, call the nephrologist because they need dialysis, right? So just know it varies with a lot of factors. The other thing is you have to make sure there's not an increase in creatinine formation. In other words, that you don't have muscle damage or injury. So like if somebody's had a major crushing injury, their creatinine will be elevated for weeks. Not because they have a kidney problem, but because their muscle is turning over. Okay, then we have PAH, para-aminohippuric acid. This is a molecule that is filtered and heavily secreted, like to the point that almost all of it is removed, right? So here's our PAH in, some is filtered, substantial secretion, and then just a small amount remains in the blood. So what this test allows us to do, it's similar to what we do with the other. We give a known amount of PAH. We detect how much PAH is in the urine over time. That gives us a milliliters per minute, right? And then we can use that to calculate renal plasma flow. Okay, so remember, renal plasma flow is how much blood flow did it take to make the GFR that we got. Okay, so if we want to test how well blood is flowing to the kidneys, how well the kidneys are receiving whole blood, this is how we would do that with para-aminohippuric acid.